Hello and welcome. My name is Nelly Gishobi. I am a psychologist and a mental health advocate. Welcome to this channel where we talk about mental health, psychological issues, and of course lifestyle issues that affect us in one way or the other. We attempt to look at them in a way that can contribute to us positively and that can help us recover and heal, especially if it has been a mental health issue. And so today I want to talk about mental health in Africa, because I believe if something is not done about this, it could affect us as Africans and it could really cost us a lot. And this has been a topic that has been very dear to me, because I believe that the development of any nation is really directly linked to the wellness of the people. And so if the people are not able to look at their total health, they cannot really be able to operate on an optimum or give any results. And so mental health is something that we as Africans need to change how we have been looking at it, because there have been very negative narratives that have surrounded mental health conversations in the past. And of course, globally, the conversations are ongoing and they have peaked, and of course they are doing very well. And this is something that I would wish that could happen here in Africa, that we can change the narrative that has been surrounding mental health conversations. Because if we do not achieve what it is that we've set, it curves poverty, and of course there is always a direct link between poverty and mental health. It's like a vicious circle. When somebody cannot meet even the most basic needs like food, mental health, healthcare, they will definitely have some mental health challenge at some point in their lives. And of course, if they cannot afford proper health care, they will develop some physiological problems that are directly related to psychological problems. So I think we need to address mental health issues globally so that we are able to achieve some of these goals that we have set as a people, as the human race, towards our development. And of course, mental health in Africa, a negative narrative has been contributed by so many things. One of them is stigma. From an early age in childhood, many children have grown up learning how to stigmatize people with mental health, especially in Africa. There has been a lot of stigma, especially because of traditional beliefs, and some of these beliefs are like, if you see a family having a mentally ill person, especially one who suffers from a psychotic disorder, that person could be bewitched, they could be cursed, they could be having demonic possession, and that kind of a thing. And so these traditional beliefs have caused even families to oppress their loved ones, because they cause so much torture by probably some of the examples are chaining them and not allowing them to even see the light of day, because as a family those people don't want to be seen as people who have probably a curse is running in the family, or they could be bewitched, or they have demonic problems in that family. And so some of these myths have caused so much suffering to people who have had mental health challenges. And of course, anybody who has had a mental illness may not even want to speak out, because they don't want to be seen and to be labeled as a mad person, as a person who has demons, as a person who has been bewitched. And so people have been suffering with these illnesses because of these myths and beliefs and stereotypes that have surrounded mental health. And so this stigma is something that we need to address as a continent, because we find that some of the mental illnesses are caused by hormones, they are caused by lifestyle issues, they are caused by environmental factors, and we cannot pin them on some of these traditional beliefs. We need to treat people as sick people, as ill people, so that they can be able to recover. And I would like to mention that mental illness, mental health challenges are treatable, and so we don't need to look at them with that negativity, and making them go into the corner and wallow in their problems and never really voice out. And this is why we are seeing a high number of people who are dying by suicide, because of course they are unable to talk. We cannot say somebody committed suicide. This person died by suicide, because for a person to get to a place where they die by suicide, it means that this person was ill. It means that this person was mentally challenged. I mean, they could not be able to see that before doing that. They went through their stages of suicide, and they got even to the last stage without viewing themselves as somebody's daughter, somebody's mother, somebody's husband, somebody's friend. So instead of saying that people committed that act, we need to say that they died by suicide. So these are some of the things that have contributed to the stigma that has made so many people not even want to talk about mental health illnesses. And so I believe that psychoeducation and a lot of sensitization and advocacy can help people to change the narrative and help them to understand and address those preconceived ideas on mental health. Issues of culture. Of course, mental health has not been something that has been in our lexicon. I mean, somebody says we have not really been hearing people talk about mental health openly, and so it's something that we are adopting right now, and we are overcoming that challenge. The government being able to put policies and scaling up mental health services by having better policies, proper funding, because I believe at this point it's very negligible, and we should have even proper training at the healthcare and even in the most rural places, so that everybody understands, and proper structures should be put in place. Just like we responded to the pandemic, just like we responded to HIV, just like we responded to malaria and all these things like typhoid, cholera, we also need to have structures that have been set to address mental illnesses even at the basic community level, so that even any health worker can be able to treat or refer someone, because they understand, because they have been trained. They can be able to refer somebody who has a mental illness to the proper professionals, to the proper practitioners, so that they don't die because of even the stigma that may be in healthcare facilities. And of course, we need to integrate preventive measures. We don't need to always wait for stages where we should cure people. We need to adopt preventive measures by looking at how we live, changing our lifestyle. We need to also educate people that mental illnesses are treatable. Some of them are reversible, and of course you can live a healthy life, because it's like any other disease. If it's a terminal disease, you are able to get counseling, and you are able to cope with it. And of course, if it's treatable, you get the treatment that you deserve. And so we need to adopt those systems even when it comes to mental health. If health starts at home, health starts in the community. So let there be training and psychoeducative seminars to train people, so that you can reach even the people in the rural areas and help them understand what mental illnesses are. So I believe when we do this as a continent, we will start moving towards raising our economic status, raising just raising ourselves from where we are at this point. Because of course, we will be addressing one of the most important factors that contribute to proper human functioning. Many things have challenged Africans, and of course we are developing, so we need to really be in a proper state of mind so that we can be able even to be to join the world in these conversations and in the development and industrialization, even at the grassroots, so that we can be able to achieve our developmental goals. Let me know in the comment section whether you think that mental health is being addressed in your local communities or in your areas of influence. Do people still believe that mentally ill people are bewitched, or they have demonic possessions, or they have spiritual problems? Let me know in the comment section. Let's engage. I would like to hear your point of view concerning this, because of course this is Africa, and of course Africa is our business. And at this point I would like to kindly request you to turn your awareness to the subscribe button. If you haven't, kindly subscribe, turn on the notification button so that you can know when I upload new content, and share the content, because of course I would like to reach as many people as I can concerning changing these myths that have surrounded our mental health as a continent, as a people. I would like really to see some change in this, and so that's the whole purpose of this advocacy channel. And so also, as you engage me in the comment section, let me know your feedback, and I will really appreciate that. So until next time, see you.